When we last left Professor Salvare and Pete pays too much on their journey, we learned that costs are initially high to create the incentives necessary to research and develop a new medicine.
Pete, we're here at a drugstore. Check out the price of this new medication.
Gosh, that is a lot.
That's because the drug is brand new. To create incentives for innovators to develop new medicines, we give them an opportunity to exclusively sell the drug at a price that encourages innovation. Let's fast forward in my time machine. Step right in. Now it's a few years later. Look at the cost of that drug today, Pete.
Gee, that's much cheaper. How come?
Well, once the exclusivity period that incentivizes innovation has expired, we encourage competition. Now there are a lot of companies stepping in to offer the same drug, which we call a generic, and at a much cheaper price than the original drug. 90% of the prescription drugs we buy today are generics, and thanks to all of this competition, 95.3% of generics had a copay of $20 or less. Generics hold down the rising cost of medications. Express Scripts, for example, saw an increase of just 19 cents last year in the out-of-pocket patient costs for a 30-day supply of medicine.
Professor, if generics are so cheap, then why is so much spent on prescription drugs?
Well, there are two reasons for that, Pete. The first reason is what has been called the prescription escalator. The older we get, the more drugs we take. So even though each individual medicine may be affordable, seniors take more of them and spend more overall on drugs. Second, a tiny number of medicines are so expensive that they account for a big share of what America spends on prescription drugs. The top 5 drugs alone account for more than 10% of our total drug spending.
Professor, what can we do to help people who have to pay a lot for these drugs?
We need reforms to our current insurance regulations to help patients cover the risks of needing these expensive drugs. Pete, your lesson for today is this. By promoting affordability, we help ensure greater access to medicines for patients.
Join us next time as we continue the journey to escape the drug pricing maze.